There is no best exercise for weight loss. I divide exercise into 3 areas: activity, aerobic exercise, and resistance exercise. Now, as I said before, to succeed, you have to do no more than become more active. But there's no doubt that different forms of exercise provide different health benefits, and you need to know this. For example, if you do aerobic exercise, it increases your HDL cholesterol, or the good cholesterol, which is terrific because you need that to protect your heart. It doesn't do anything for LDL cholesterol, which is the bad cholesterol. If you do resistance exercise, on the other hand, weights, push-ups, things like that, you decrease LDL cholesterol, which is the bad cholesterol. So if you do both, you get a double whammy, you get both benefits, and that's why different exercises done at different times are very important. And the other thing about resistance exercise, it's probably worth saying now, is that we've learned just in the last few years that resistance exercise increases your body's ability to use glucose. And that's why the International Diabetes Institute now uses resistance exercise as part of its treatment for people who've got diabetes or are trying to prevent diabetes in them when they have issues with potential. So all of these things do, exercise is essential for you for health and wellness, but it's certainly essential for improving metabolism, improving fat loss, and improving your health and well-being. So highly recommend it. If you're not doing it already, start immediately. There is, I like to call this, and this is certainly my concoction, the slippery slope that leads to obesity. And that's something called insulin resistance. Insulin resistance is the problem that the body has. People who develop type 2 diabetes, which we'll talk about in a second, have initially something we call insulin resistance. In other words, they make enough insulin, unlike the type 1 diabetics who get it when they're very young, who need insulin injections. They just don't make enough insulin. So it's a totally different problem from the diabetes we're talking about most of the time. And these people are usually genetically predisposed to have liver cells and muscle cells that don't respond to their insulin as well as they should. What's the problem? The problem is that when they gain weight, that becomes worse. And if they gain visceral fat around the tummy, that gets worse. And if they have inactivity, it gets worse again. And if they have a bad diet, it gets worse. And as they get older, it gets worse. So all of a sudden, you've got a metabolic cascade, this runaway phenomenon of getting something worse and worse. And that's why if you'll see someone who's significantly overweight one year and see them a year or two later, all of a sudden I've gone to obesity, and it seems to have happened virtually overnight. Why? Because their insulin resistance has gotten worse and worse. And the end result, I'm not sure if I've got that here, no. The end result is diabetes, because as their insulin resistance gets worse, they have to create, the pancreas has to make more insulin to do the same amount of work on each meal. After 20 or 30 or more years, it just becomes fatigue, stops making enough, and bang, you've got diabetes. That's why there's a diabetes epidemic hand in hand with the obesity epidemic. And it's just as clear as daylight. It's not, and it should not be a surprise. This is my formula for weight loss success, and I certainly stick to it religiously. It's no good just giving people a diet and saying, go and do this. The first thing that must be done is goal setting. You have to set goals, and you have to be very serious about it. And I mean, when I say goals, I actually mean goals, you know. And it doesn't have to be a weight goal. It could be a dress size, it could be fitting into something for a wedding or for a special occasion, but a lot of the time it's weight. And short-term goals and long-term goals are absolutely essential, because if you don't know where you're going, you're not likely to get there. I believe very much in assessing people's metabolic profiles, because different people have different dietary needs, and for some people, carbohydrates are a major issue, and for others it's fats. And if you are insulin resistant, and I focused on that for a while, carbohydrates are your problem, and you've got to cut them right back. Once that's fixed, or if you don't have that problem, it could be fats or many of the other things that we're talking about. Individual nutrition plans are essential because different metabolic types in different people require different diets and different attitudes. There has to be an exercise and activity plan related to all of those things that I just discussed with you, because different exercises do different things, but they all help you to lose weight. And there are ways, believe it or not, to stimulate your metabolism. And you can do it. I'm a big believer in lifestyle medicine, trying to do it without drugs. The big myth out there is if you take your Lipitor or your other cholesterol-lowering drugs, and if you drop your blood pressure with an antihypertensive medication, everything's okay. But a lot of people don't realise that even those who've dropped their cholesterol from 7 to 4 with Lipitor can still die suddenly for all the other reasons, and 50% of them do. So pills are never quite the answer. It's got to be much more than that. Stimulating metabolism is not impossible and can be done, and stabilising the hormones that make people fat or make them prone to weight gain is also essential. And again, that can be done with dietary manipulation, and it can be done with exercise. But last but not least is something I call neuroassociations. And neuroassociations are the feelings. Neuroassociations are the feelings that people associate with dieting. And most people find that dieting is usually associated with deprivation and misery and missing out. And the fact is, it should not. Because you have to, it's like the old ads for Coca-Cola. They always associate it with fun and good times and so on. And you can be taught to associate eating the good foods, and I mean really good foods, with feeling good, and eating the junk and the poisons with feeling bad, rather than feeling that you're missing out. So one of the things I always tell my patients is there's nothing that you can never have, and there's nothing that you must have. But it's what you eat most of the time that counts. So we never tell them they can never have chocolate or ice cream or anything like that. There are plenty of medical conditions that do predispose you to weight gain, and they're all here, and most people don't have them. And there are drugs and medications that predispose you to gaining weight much more easily, including insulin, interestingly enough, and steroids and things like that, and antidepressants. But just because people take them doesn't mean they can't succeed in losing weight. It just creates a bit of a problem. And just to finish off, there are lots of so-called medications that you can buy over the counter that claim to stimulate metabolism. None of them work. There's not one, it's not the Fat Blaster, I couldn't tell you the names of the other half dozen. There's not been one of these over-the-counter products that's been shown to make one iota of difference in stimulating metabolism. How they get away with it, I'm not sure, but they do. But these three things have shown to make a difference. But I want you to realise, don't go out, and I'll explain them in a second. Fibre does improve metabolism, and it increases the transit time of food in the bowel. Very good for you, but it's not going to take you from fat to skinny overnight, but it does make a difference. Caffeine, a lot of people are told not to have coffee when they're on a diet. Nonsense. I'm not talking about the health or the benefits or the non-benefits of having coffee or caffeine, but caffeine does stimulate metabolism. Not by 10 or 50%, but a little bit. And the other stuff is the capsaicin. Capsaicin is the hot stuff in peppers and chilies. That's also been shown to stimulate metabolism. But don't go out and buy jars of chilies, because it'll only make an infinitesimal amount of difference. All of these things, eaten in their entirety, will make a difference, but the pain could be too much. And that's all for now.